Alrighty, so hi everybody. My name is Sammy Riccio, and I am the Donor Engagement Coordinator for Hawkwatch International. And I want to welcome you to our event on blood feathers, which is part of our Take a Bite Out of Science series. So Take a Bite Out of Science is our lunch and learn lectures where we take big complex topics and then put them into bite-sized nuggets digestible for everyone. So this presentation will run for about 30 minutes, and we will start off with Dr. Nicolle Lofgren from Mountain West Veterinary Specialist Exotics, followed by Chris Butler, one of our educators, and a Raptor ambassador. So we will save the last 5 or 10 minutes or so for questions and answers. So if you have any questions throughout the presentation, please pop them in the chat. I want to mention that we're able to offer this programming for free thanks to ZAP for those of you who are local to Salt Lake County and with additional support from donors like you. So with that, I'm going to pass things off to Dr. Lofgren.
All right. Hey, everyone. Let me just get my PowerPoint up. Okay. Can everyone see this okay?
Looks great.
All right. Awesome. All right, guys. So like she said, I'm Dr. Nicolle Lofgren at Mountain West Veterinary Specialist in Layton, Utah. I'm our exotics doctor. And today we're just going to be talking a little bit about blood feathers. So we are going to start with some feather anatomy. I am not going to go too into detail with feather anatomy. If you went to the molt lecture, you guys got a lot of detail on that. We're just going to touch on the important parts for when you have a blood feather. So on the right side there, you can see a mature, fully grown feather, so not a blood feather, is a letter B. And at the bottom, I just want to draw your attention to the portion called the calamus. That is the part of the feather that lives in the follicle, so it's within the skin, and it's actually anchored to the periosteum, which is a part of the bone, so it's anchored to the bone once it is matured like that. On the left, image A, you can see a blood feather. This is sort of an old blood feather. You can't really see the blood supply anymore, but you can see at the bottom that calamus starts out while it's growing as something called the epidermal collar, and then there's this big, long keratin sheath. So it's kind of like this tube that covers that growing feather and acts as protection. And it does also have a blood supply, which we're going to get into as well. And then on the far left, I just have a picture that I think very nicely demonstrates the way that these feathers along the wing are anchored to the bone. They are connected to the bone there, and that's going to be important when we talk about pulling a broken blood feather. So feather growth, when a blood feather comes in, on the diagram on the right, you can see that there is actually a blood supply that grows up the growing feather shaft. So that's something called the axial artery. There's also an axial vein that goes along with it. And if you look at the comparison between the mature and the growing feather, you can see that the shaft of the blood feather is this really deep purple color, and that is the blood supply that is present. So you can actually see when a feather is a blood feather, when it has that blood supply. So as the feather grows in, it kind of grows up in portions where there's this pulp, which is this nutrient content that helps to supply that growing feather with the nutrients it needs to grow, and the blood supply growing up into it, and then that keratin layer over top. The other thing I just want to show you is on the blood feather picture, you can see that the end of it, where it is actually connected, is sort of rounded as compared to the tapered end of the mature feather. And that's something that when we are pulling blood feathers, we look for that rounded edge to make sure that we have pulled the entire feather. If you leave any behind, that blood supply will remain and it can continue to bleed. So what is a blood feather? So a blood feather is actually a normal process. It is not a disease. It's just a replacement feather that comes in most commonly when a bird is molting. Although sometimes, especially with birds who pluck, or if there's some sort of trauma that causes feather removal, then a blood feather will grow in. Growth of a blood feather can take a month or more depending on the species, so it can take a really long time, especially in those big feathers of the wings and tail. And it does have a blood supply, and like we talked about, that keratin sheath that protects the feather as it grows in, that sort of is a tube around the growing feather. Commonly, though, when someone says blood feather, what they're actually referring to, so for example, when someone calls into the clinic and says, hey, my bird has a blood feather, usually what they're referring to is actually a broken blood feather. So a blood feather that has been traumatized in some way so that it is actively bleeding and that blood supply is open. So there are a lot of different causes for a broken blood feather, trauma being the most common one. So trauma can be due to hitting the wing against something, most commonly cage bars, or crash landing. So for example, in my heart disease patients who have a hard time getting up or landing safely, sometimes just hitting the wing really hard against the floor can cause a broken blood feather. Improper wing trims. So when we are trimming the wings, we do not want to trim blood feathers because you will be opening up a blood supply. So if a blood feather is actually cut, then it will actively bleed. Or if a blood feather is exposed. So I want to just draw your attention to this x-ray that I have here. I think it really nicely demonstrates the way that blood feathers grow in, which is in most species, not all at once. So you can actually see the blood feathers here on this x-ray. They're labeled as developing feathers on that wing on the left. And you can see right in the middle of the wing that there's two feathers where you can actually see them as a sort of white color, and that's that blood supply. And they're distinct from the mature feathers that no longer have a blood supply. You can't really see them on the x-ray. And I want to point that out because when the blood feathers grow in, they don't all grow in at once because we need those mature feathers to protect them. They need sort of this layer of protection so that if the wing does hit something, those feathers are not damaged. And so if we get a wing trim, even if it is done correctly with just the outermost, 5 feathers or so, if we are exposing a blood feather that was protected by a mature feather, it is more likely to become traumatized, even if we're not cutting it directly. And then improper housing, too small of an enclosure. If an animal can't stretch their wings out all the way without hitting the bars or hitting the sides of the enclosure. Mutilation, less common, but sometimes if an animal is irritated, either because a blood feather is growing in incorrectly, or because maybe there's infection or a mild trauma that didn't actually cause bleeding, they'll actually chew on the feather, which can cause damage to the feather itself and bleeding. And then infection. So infection can be an infected feather follicle just from bacteria, or there are some infections that actually cause trauma to the growing feather, to the blood supply of the feather. So for example, West Nile virus can cause injury to the vessels of that blood feather and can cause the feather to form abnormally. And sometimes those feathers will get plucked and can cause an active bleed. And then of course on this x-ray you can maybe see, but that left wing is actually broken. The humerus is actually broken. So that can be pain for the bird where they want to pluck at the feathers in the painful area, and they might cause damage to a blood feather, even though the blood feather itself or the follicle itself is not the issue. So any sort of trauma. So if you have an active bleeding blood feather, most commonly people talk about pulling that feather, actually plucking it out to stop the bleed, to take away that blood supply. When you're pulling a feather, there's a few things you have to consider. Pain. I am bringing up a similar image to the one before so that you guys can see that those feathers are again anchored to the bone. They're connected to the bone. So if anyone here has ever broken a bone, you know that it is painful, and that's because your bones have a nerve supply you can feel. And so when you're pulling something out of the bone, it can be painful. So pain is one of the considerations when we're pulling a feather. Bleeding, even if we are getting rid of the main blood supply by pulling that blood feather, you may still see a little bit of seeping coming from that feather, from that follicle once it's gone. The stability of the bone. If you are pulling something off a bone, especially at the end of the wing, where we get these really small bones at the end, or the alula up here, or if you're pulling off of the humerus, which is one of our pneumatic bones or our air-filled bones, if you pull too hard and you don't have the bone stably in place, you can actually break the bone or cause damage to the bone. So the stability of the bone is an important factor. And then the integrity of the feather. Are you pulling a feather that maybe is going to break within the follicle? If the break is within the, or close to the skin, and again, we leave that bulbed end in, it can continue to bleed. And then infection. If this feather was broken because of mutilation, mouths are gross. Every single animal has a bunch of bacteria in their mouth. If there's infection in the area, that skin is going to be especially fragile. It's going to be irritated, and you might want to do some antibiotics and things like that, your vet might want to look at it before we consider pulling it out and causing more damage to the area. So when we get a broken blood feather in the clinic, it is much easier to address these considerations for pain control. Typically, I'll use lidocaine, which is a local anesthetic, so we can inject it actually into the follicle itself and just let it numb the area for a little while so that it is not painful for the bird when we pull that out. Hemostats, which are this little instrument I have pictured over here, so that we can, and you can see there's sort of this area where when you close the hemostat, it clicks in to hold in place that so that we have a nice firm grip on that feather when we pull out. Gauze, for in case there is bleeding, you want to put manual pressure on that. And then I really like this picture of them pulling the blood feather because you can see that the person is actually holding the wing, and what they're doing is they're holding the bone that they're going to be pulling the feather out of so that it is stable, so that we're not creating a fulcrum and potentially causing damage to the bone. So usually this is a two-man job where someone's holding the bird, someone's holding the wing and the feather itself to be pulled. The other consideration is, should we remove the feather? So in very, very small birds, so for example, here in the clinic, we'll get little budgies sometimes where a blood feather breaks and there is really significant bleed. Remember I told you guys that that keratin sheath acts almost like a tube, so it acts almost like a straw, and by capillary action, it can actually pull a lot more blood out than you would expect, and you can have pretty significant bleeds from blood feathers. So in very small birds, you usually don't want to risk, even if the blood feather has stopped bleeding, you don't want to risk re-injury. And so usually it is correct to pull that feather, but and for example, in like kestrels and little small birds. But in very large birds, sometimes if you can stop the bleeding, leaving it in place is going to cause less risk to the follicle itself. And that follicle is going to continue to grow feathers nice and normally if you can leave it as intact as possible and not mess around with pulling the follicle or the feather out and things like that. And so sometimes leaving it in place in the bigger birds, if you can stop the bleeding, is actually the correct choice, as long as the animal does not seem painful or anything like that. At home, you can manage a blood feather at home. So like I said, pulling it is not always the correct choice. So if you have a larger bird at home, sometimes stopping the bleeding is what's recommended. Pulling it at home is a little bit tricky because of those things that we talked about, pain control, stability of the bone. Things like that are much easier to kind of manage in the clinic. And then also if there's an infection or the follicle itself is abnormal, that's something that your vet might be able to tell in the clinic and address in the clinic. At home, stopping the bleeding is the most important thing. You want to use things like cornstarch, manual pressure. You can use quick stop. You do not want to use like silver nitrate or anything that's very irritating. If you use an irritating coagulant, then they can actually start to pluck at the feather a little bit more. It'll be something that they want to chew at, and it can cause more damage. If you can stop the bleeding at home and you have a larger bird, then pulling that feather might not be the correct way to go. And if you're concerned, you can always stop by your vet. But some references for everyone. I think that is everything I have.
Thank you so much. Chris, are you ready to take the reins?
Yes. Alrighty, so zoom my camera in here a little bit. So this bird here is Galileo. He's going to move around quite a bit, as you'll see. That's normal for him. So I'll give you his backstory and then some facts about him, as well as why we chose Galileo for this program. So you'll see him again. He'll fly around. He doesn't like to sit still, but so Galileo is a short-eared owl. They are a species that can be found all across the United States, Canada, Mexico. They are even found in Hawaii, which is pretty nifty. And so Galileo was found in Ogden, crashed into a barbed wire fence, which injured his left wing. You can see it droops a little bit and sits a little bit differently than his other wing does. that barbed wire fence did damage to his patagial tendon. So that's the tendon that moves from his shoulder to his wrist. And so while you can see him move around and he flaps really well, he doesn't actually sustain flight very well because of that injury. And because he cannot fully fly, he is deemed to be unreleasable by the U.S. Fish and Wildlife Service, who we also have permits to have him as an education ambassador. So some other interesting things about Galileo and why we picked him for this blood feather course is because he doesn't actually form strong keratin. So his feathers and the keratin sheath that was talked about with growing feathers, all of those are really weak with Galileo. So his feathers are very prone to breaking, especially during that time where they are blood feathers, so that blood is flowing too. And so when he is molting, he doesn't do any programs. We try and be as hands-off as possible with him. And while his feathers are looking nice right now, let's see if we can still zoom in on some of those. Let's check this side. So it might be a little hard to see on some of these, but you might be able to notice some of these feathers, particularly on the tips, are a little bit broken off, and that's just him as he flies around in his mew, so his enclosure. He just naturally bumps into things or is a bit clumsy at times, and so he breaks feathers really easily, which also contributes to his poor flight ability. Some nifty short-eared owl facts for you. We know most owls are nocturnal. Short-eared owls don't subscribe to that. They are mostly diurnal, so they hunt during the day. They are also ground nesters, so they live on the ground rather than up in trees or cavities like most owls. They still eat many of the same things, so your mice, rodents, things like that, but they just do it from the ground. Do we want to start doing questions now, Sammy? Or if there are some?
Sure. So yes, if you have any questions, let's pop them in the chat now. We have about 10 minutes left of our presentation. So I have a question from Jenna asking, we have a kestrel with a disabled L wing and her long flight feathers need to be trimmed because they stick forward and she trips on them if we don't. I'm wondering if it is bad to trim her flight feathers as they are growing in. She will not let me do it on glove. Or do I need to wait until they are fully grown out? I have never seen or cut blood feathers, so I am not trimming that far up, but I don't want to damage the follicles long term.
I will let Nicolle take that one.
All right. So typically when I am looking for whether or not it is appropriate to trim the feathers along a wing, what I'll do is I will actually take the wing. I have a sample bird here. That's who I'm looking at. I will take the wing and I'm just going to get her out. Is that okay? Give me one.
Yeah, go ahead.
Yeah.
Love that your camera follows you around.
I know. Okay. I know. She's mad. All right. So when I am looking at the wing, what I'll do is actually pull the wing out, and you can see that we have these covert feathers on the top. So I'll pull those aside and just check the actual portion of the feathers, so the calamus, and just make sure that it's not that dark purple color. If it's not that dark purple color, then it is not a blood feather. So for example, Syl here does not have any blood feathers, so it is appropriate to trim these feathers. Still then, you only want to trim about 5 or 6 of the primary feathers, so out here, and you don't have to do more than that. Otherwise, it's not going to be able to glide down with those secondary feathers. So just depending, if they are in active molt, then I do not recommend trimming those feathers, just in case you do accidentally hit a blood feather, but you can check for it beforehand.
Thank you. So I was just curious, how often do you have to deal with blood feathers? Like how commonly does that come into the office?
I would say that is one of our most common emergencies that people bring in. And a lot of times they're not emergencies. Like I said, usually it's the really small birds where the bleed is significant enough to really matter. But I would say at least once a week we'll get some sort of blood feather.
Oh, okay. And Chris, as far as Galileo goes, how often do you feel like, I know since he has special issues that he has things happen more often, like how often is it a concern that you have to deal with blood feathers?
Yeah, so we do our bird care and so husbandry, so like clean out their mews, give them their new food every day. And so with him, we're always just kind of giving him not necessarily, hands-on with him, but just looking to see how he's flying. Is he in the process of molting, which usually happens twice a year for him. So around that late spring, late fall time tends to be his molting time. And so when we do start to notice that he is losing more feathers, that's when we'll slow down on having him go to programs, as well as if we do ever get him on the glove, then we'll really try and look around and see if we see those dark, marks that kind of indicate blood feathers. I don't know if you just heard him poop on the microphone, but so we'll look for those signs, and then usually about twice a year we might notice something like that, and then we just leave him alone for a while, so that way we're not increasing our chances of him breaking those feathers. He hasn't broken any blood feathers in a couple years now. And, while we do our best to prevent that, he can be a bit of a clumsy bird. I think part of that is being a ground nester. They're at a lot more risk of predators coming to get you in the wild. So he's just a little more high strung than some of our other birds. So he's just can end up, just naturally a little more reckless with his movements. And so just on his own, he's broken some, but we've never had any significant problems. We've always been able to keep things under control with his blood feathers, luckily.
Right. I have a question asking how old Galileo is.
Yes. So a lot of our birds come to us as an adult, and once they have their adult feathers or plumage, it's really hard or pretty much impossible to age raptors. But Galileo was in his hatch year when he was found. So that was in 2016. So then if you do some quick math here, 16 to 22, he is, 6 years old now? And because, again, he was in his hatch year, so he didn't have his adult feathers or anything. That's how we are certain about his age, where most of our birds, we can just have a best guess. So he's 6 years old, which also short-eared owls are knowledge gap species. So we don't actually know what a good lifespan is for them. But likely he's, middle-aged.
Great. That was the next question, so you answered it for me. I have another question asking, are multiple blood feathers in one area bad/dangerous at all if they're not broken?
No, and actually it's pretty common for us to see even 2 or 3 lumped together at a time, again, depending a little bit on the species, but it's pretty common to see multiples. As long as they're not broken, it's okay.
Do you feel like they grow in symmetrically on birds, or do they tend to grow at different rates?
Most parrots grow in symmetrically. Some species of raptors are very chaotic and just randomly grow them in. Some grow them in symmetrically. It depends a little on the species. But with most of our parrots, yes, we do see them on both sides.
Great.
Yeah,
Okay,
I'd say
go ahead, Chris.
I'd just add, I think ours are pretty chaotic. Like our Merlin went through a molt not that long ago, and he had basically like random bunches grow in, but there wasn't necessarily a pattern to it.
Gotcha. Well, thank you to both Chris and Dr. Lofgren and Galileo for joining us today. And thank you all for attending. As a reminder, we do put the recording on our YouTube channel. So if you missed it or if you want to just watch it again, it will be on there. But yeah, thank you all for coming and have a good rest of your Wednesdays.
Cool. Thank you.
See you, everybody.